Hello everybody and welcome back to the channel and to today's video. I know I've said this for the past few videos, but I do apologize. It's taken me about a month to get this video out. I've just been still very low energy and I've been very tired. So it's just, it's a lot of effort to make these videos and edit them and get them out. So I appreciate your patience, and I also appreciate that you're back and watching and viewing with me. But yeah, I've just been very tired and I've had very little energy. So I'm just trying to get this video out now. Before we get started, I just want to acknowledge and recognize that I have broken 100 subscribers, which is absolutely amazing. I just want to give a huge thank you to those who have been watching the videos and subscribing to the channels. It absolutely means the world to me. It's not always easy to find, a purpose when you're faced with medical challenges. If you have suffered from chronic illnesses regularly, then you probably know what I mean. But this platform does give me an opportunity to be as candid as possible and really, talk about my experiences and hopefully, share them with people who are going through the same thing. And I really appreciate so many of you for following along with me. Also, I'm at my 10th video now, which seems crazy. I started back in, I think it was June or July, and it's been, about 5 or 6 months now. So thank you to those who've subscribed and followed along. I really do appreciate it. I have so many more video ideas to come out with and more topics to talk about regarding my cancers. So if you haven't subscribed yet, please feel free to subscribe, and, please also feel free to comment and ask any questions you might have. So today's video focuses on the side effects I've faced through my surgeries and immunotherapy treatments. Before we do start and dive into the actual content of the video, I do want to just acknowledge and put a kind of a disclaimer out that, the side effects that I have personally faced are by no means an exhaustive list of the potential side effects that someone who's going through immunotherapy or these types of surgeries might face. There are many more side effects that somebody could experience, and each person's side effects will be different from one person to another. It's even possible to have no side effects at all. I think that's a bit more rare, but it is possible. And again, the side effects that I'm going to talk about today are the side effects that I've personally been dealing with. Some of them common, some of them a little more rare, but we'll get to that. So without further ado, let's jump into it. So I want to start with the side effects that I faced when I was going through my nephrectomy. For those of you who don't know, a nephrectomy is the removal of a portion of one of your kidneys or the full removal. So there's what's called a partial nephrectomy or radical nephrectomy. I had a radical nephrectomy where they removed my entire right kidney. I'm sure I've mentioned that in an earlier video, but I had the whole entire kidney taken out. And I do apologize, I'll probably end up looking at my computer a little bit just to kind of talk about these things, just because there are so many of the side effects that I have faced. So it's just a lot of information that I need to read, but I'll do my best to kind of stay engaged and looking at the camera. So the first side effects I faced kind of from my nephrectomy is pain, which is an obvious one. When you have a whole big surgery that's removing an organ, of course you're going to face pain. It makes sense. In the beginning, it was super unbearable, and, especially while I was in the hospital, I was, on a lot of different pain meds, and it did manage it pretty well, but still, like, when you're cut open, of course the pain is going to be severe. It really hurt to move even in like slight ways, like just tiny movements would hurt like my whole abdomen. The day after the surgery, my healthcare team wanted me walking just because they wanted me to avoid blood clots, and it was just good to be on my feet and moving around. But that obviously came with pain because you don't really kind of realize how much of like your core you use when you do just simple movements, even like walking, right? Like it was really, really hard for me to kind of get back on my feet and walk. I had to use a walker. and I had Megan by my side holding one of my arms to make sure I stayed balanced. Unfortunately, while I was in the hospital, I think I did overexert myself a little bit because I think it was the next day after, well, it was the third day that I think I overexerted a bit because I was feeling a lot more pain than I had. So I had to reduce the amount I was walking. I think it like was good that I was doing it, but for the sake of avoiding the pain, I had to kind of, cut down how much I was actually walking out in the halls. Another side effect that I experienced, which is it's been very traumatic for me, and it's kind of, it's led to a lot of like post-traumatic stress, or yeah, like post-traumatic stress after the surgery, is blood clots in my urine. It's one thing to have, a tiny bit of like color in your urine that's like a bit pinkish or red, but then it's a whole other thing to have like big clots come out in your urine, and it's just it's a really scary thing, especially when you feel it and you can feel that pain, and it's not pleasant, and it's been really hard for me. This is 2 years now after my surgery. Actually, this month it's been 2 years, and I still feel nervous every time I go to the washroom to urinate. I'm nervous that there's going to be clots in my pee. I'm nervous there's going to be coloration, like red or pink coloration, and it's scary for me every time I go. Like it hasn't gone away, and I'm not sure that it ever will. It's funny, recently we had some beets, and I haven't had beets in a while, so when, after like dinner, it was like a few hours after dinner, I went to the washroom and my urine was like very, very pinkish red, and I got really scared, obviously, but beets will do that to you if you have like, I guess, a sufficient quantity of them to make your urine that color. For those of you who may be facing the same kind of trauma from having blood clots come out in your urine and dealing with that, I don't know if there's any like real good way that I've kind of like faced it with. It's just taking it one step at a time, and if it does happen, trying my best not to freak out. And I really lean on Megan a lot to talk to her about it when and if it does happen, just to kind of, calm myself down and try and, relax a bit, because it's always going to be a scary thing no matter what if you have blood in your urine, because obviously it means that something's not quite right. But I think, between leaning on Megan, my support system, and, my anxiety medications, it hasn't taken all that away from me, all that trauma, but it definitely has made it a lot easier. So I know I've recommended, methods to kind of deal with anxiety and stress, and I do think that those kind of are, a nice blankets kind of coverage of how to kind of make yourself feel better. But there's no real answer of how to cope through these things and get through them. You just kind of have to figure out what works best for you and do the best you can. While I was in the hospital, I did have a catheter in, and I think I've mentioned this before, to help drain the urine. I did have a lot of trouble urinating after my nephrectomy while I was in the hospital, and that is one of the criteria they use for letting a patient go, is making sure that you can urinate essentially freely. And I was having a lot of trouble with that, and that's kind of what made my stay at the hospital a little longer, because I was having a lot of trouble urinating after the surgery. So they did take the catheter out, and they did have to recatheterize, if that's a word, or put the catheter back in, because I was having a lot of trouble urinating. My bladder, it wasn't quite distended, but it was getting very, very full. I think they said something like a male bladder can hold around 600 to 700 milliliters of urine, I believe, and I was pretty much at those limits. And unfortunately, they said they don't recatheterize unless it's your bladder's distended, but we asked our nurse to get in touch with our urologist so they could come put the catheter back in so it could drain the urine for me, because I couldn't couldn't get my urine out. Like it just wasn't happening. And, that also really led to my, trauma of urinating and not being able to, because it was a really horrible experience. While I was in the hospital and when I got back home, another side effects I had was trouble sleeping due to my pain. I couldn't find like any way to get comfortable except for on my back, and I'm not a back sleeper, so I was having a really hard time sleeping after my surgery. And obviously, sleep and rest is something you really need for recovering and healing. But the pain I had was, unbearable. I couldn't sleep on either of my sides, and my back was really, the only way I could sleep. But, I'm a side sleeper, so it was really hard for me. And I think it took about a week or 2 weeks. Actually, no, I think it was closer to 2 weeks, maybe even 3, that I could actually start sleeping on my side again. So it took quite a while. And I think the last kind of side effects I had from that surgery was constipation. So not only was the surgery hard on my intestines, but all the medications I was taking, a lot of them were constipating. So it was hard because obviously, that puts a lot of pressure on my abdomen, and that also helped, like, contributed to the pain I was feeling in my abdomen. So constipation definitely was a big one, and I was taking things like Restorelax to try and help myself with bowel movements and trying to, essentially avoid my bowels. So moving on to my next surgery is my retroperitoneal lymph node dissection. So for those of you who don't know what that is, because it is a mouthful, it's basically the removal of lymph nodes from, it's essentially like in the abdomen area, kind of where my kidney was removed. So in that space, there's a lot of lymph nodes, and they had to remove those lymph nodes around where my kidney was because the cancer had spread to the lymph nodes in my body that was around my kidney. So they had to do that surgery to remove them to hopefully remove the cancer from my body. But obviously, I'm on immunotherapy now, so the surgery didn't quite work, unfortunately, but it was worth the try to see if it would help. So again, pain was a side effect of the surgery, and I will say that the pain from the surgery was way more significant than my nephrectomy, because the uh, the retroperitoneal lymph node dissection cuts from basically my sternum down to my pelvic area. So it's a very, very large incision that went around the belly button. So it was a big surgery. They had to like take out a lot of my organs and place them on my body. And obviously, when you have such a major surgery like that, you're gonna feel a lot of pain. The difference in pain management was, they did put a epidural in my back, which really, really helped with the pain management. But they did want to get that out of my back kind of like as soon as they could. So when I could start dealing with the pain while on more, I guess, simple painkillers, they took the epidural out, and I noticed right away how much of a difference it made having it in versus having it out, because I was in a lot more pain when they had taken it out, and my whole body just felt like it was in so much pain. The whole front of my body was in pain. It like hurt so much to move. I remember one morning my doctor came in and he like ripped the bandages off of my incision sites because he needed to see that they weren't like infected and that they were healing well. And like when I say tore, I don't mean like he like completely stripped it off, but he did like not like the most gentle way, but like also not the most like hard way. He did like lift those bandages off, and it hurt so bad. Like my whole body went into like a shock of pain when he did that. And he was like, okay, next time we do that, we'll make sure like you are fully like medicated on painkillers, and we won't do that to you again, because it was extremely painful. Another issue I had, which again, similar to the nephrectomy, I was dealing with constipation again. It was really, really hard, and it was actually harder than when I had my nephrectomy because of when they took all my intestines out and like other organs and placed them on my body. It just sent my system into like a state of shock, and my intestines weren't working. I don't think I went poo for close to like 5 days. It might have been 6, which is a normal thing, but still, like it's good because I wasn't eating a lot. So it's not like I had that much to get out, but obviously, like 5 to 6 days is a long time without going to the washroom. So constipation was another side effect I was dealing with once again from this surgery. Again, I had trouble sleeping due to pain. It wasn't as bad actually as the nephrectomy because the nephrectomy was like, it was more on the side of my body, whereas the retroperitoneal lymph node dissection was on the front of my body. So I was actually able to kind of sleep on my sides this time and not so much on my back. But I did actually have like a wedge pillow that's like on an angle to kind of help elevate my body. So I found that that actually really helped me sleep this time around because it just made it for a more comfortable laying position rather than being completely flat. So I think the last kind of side effects I was feeling from this surgery, and it was different from the nephrectomy, was I was feeling a lot of nausea, and then I had a lot of vomiting kind of immediately after going home from the surgery. So because my whole system was kind of in a weird spot, and I wasn't really eating a ton in the hospital, and I hadn't really gone to the washroom yet, I remember I got home and I had like a single like little it was basically like a little breakfast wrap, and it wasn't that big. It was probably something like that, if that like that maybe that's hard to kind of tell on video, but the wrap itself wasn't very big, and I had that after not really eating a ton, and the next day after eating it, I felt so horrible. I felt even more constipated and more bloated than I had felt previously, and I couldn't eat anymore. I felt super nauseous, and that following night, I was throwing up like crazy. And so that lasted for probably close to like 10 hours of like all that feeling and throwing up. And finally, we were like, okay, we need to go back to the hospital. And so we went back to the hospital, and they had to re-hospitalize me because they had to make sure that like everything was like healing properly, and that I wasn't dealing with the nausea and vomiting like I was having, because obviously it's not a good thing if you're just not really eating and all you're doing is throwing up. It was such a horrible experience. Like, I've never thrown up like that in my life, and it was so horrible. But my body just wasn't used to the food, and I like couldn't really, my stomach couldn't handle it. So everything that I had eaten came back up, and then for like 10 hours after that, I was just throwing up constantly, and my body was not happy with me, so had to go back to the hospital. So I think that covers the side effects I dealt with during my 2 surgeries. Again, not an exhaustive list, and some people might have different issues than I had, but luckily none of them were too severe. They were mostly manageable, but I am thankful that I'm past those stages now, because it just wasn't pleasant by any means, and I never want to have to go through that again. And I'm sorry if that's something you're going to be facing soon. Don't let it discourage you from doing these surgeries. Obviously, like, I didn't want to have to deal with those side effects. I never want to deal with them again. But if you have the possible chance of completely removing your cancer altogether through these surgeries, I will say it's better to do the surgeries than it is to have the immunotherapy treatments, because those come with their own side effects that can be, from mild to quite severe. And I've had quite severe side effects from my immunotherapy that we're going to get to. So the first immunotherapy treatment that I started on was actually about a year ago. Well, actually, it was essentially 1 year ago now. And the treatment that I started on was called ipilimumab and nivolumab. Sorry, it's really hard to say those words. But that was the first immunotherapy medications that I started on. And it's really hard to tell which drug might have caused, the specific side effects I was feeling. I know I was taking them together, but it is possible that maybe one of them was affecting me more than the others. So I'm not really sure what caused what, or maybe it was just in tandem, but I did have some really bad side effects from my immunotherapy when I started last fall. So first off, I had a lot of nausea when I started on that treatment. Skin rashes started all over my body, which we had to kind of get under control. When my skin rashes started, they put me on a steroid to try and bring that down, and it did, which was good. And then we restarted the treatment. But yeah, I had rashes all over my body. Diarrhea was a big one, and it still is a big one. I've been dealing with diarrhea for a long time now.
It's coming out of me like lava!
Last year in the beginning, it was, I was having diarrhea, but it wasn't, like all the time, whereas now, and I'm going to get to this with my treatment that I'm having now, but I now have diarrhea every single day, like multiple times a day, unfortunately. Another big one is tiredness and fatigue. I remember last fall, like immunotherapy, it really kicks your butt. Like it just takes all of your energy away. It's like sapping your energy, and it just takes all that you have. And I was so tired all the time and had no energy, and I didn't want to do anything. I remember I tried doing modified duties from work, essentially like working from home, and it got to the point where like I couldn't even work from home and do stuff on the computer because I had to sleep all the time. So that was a big one for me, and it still is. The biggest one that I had, the biggest side effects that actually led to a really big issue was headaches. So I started the immunotherapy last fall, and basically from the second I started that immunotherapy, I started developing headaches, and I had a headache every single day for just over 2 months. And I gotta say, like, it's not easy dealing with a headache every single day. Like, headaches themselves aren't pleasant, but when you have one every single day, it just, not only is it painful in your head, but you feel like kind of crazy. Like, I don't really know how to explain it. Like, I just felt like my whole body was not working the way it was intended to, and things weren't right, and I was constantly sleeping, I was constantly in pain with my head, and I had all these other side effects, and headaches are just the worst. And they weren't migraine level of headaches, but still, when you have a headache every day, it's not easy. And I was taking Tylenol around the clock. I was taking the maximum amount of Tylenol you can actually take in a day, again, for about 2 months straight. The headache eventually did lead to what's called immunotherapy-induced aseptic meningitis.
Stop! He's already dead!
Which actually led to me being hospitalized over Christmas last year. So I was in the hospital for I think 5 or 6 days last year during the week of Christmas. So we were in the hospital during Christmas because I had aseptic meningitis, and meningitis is not something you ever want to get. It's actually like it's a very bad thing to obviously have, and unfortunately the immunotherapy I was under caused me to get meningitis, and that was the reason for my headaches. The headaches were leading up to the point where I got meningitis, and in the beginning it's hard for them to kind of like diagnose that because headaches are one of the side effects you can get, but like it's hard. It's like nobody's going to be like, oh, yeah, you probably have aseptic meningitis from the immunotherapy and that's why you have headaches. It's like I was dealing with the headaches and then they got to the point where they got so severe. And then, while I was having these headaches and then it got to the meningitis points, when I started, the reason I had to go get hospitalized is because I started developing a fever. I was having a lot of nausea. I was throwing up again. And so we went to the hospital. They couldn't quite determine what was wrong. And it took them, several days. And honestly, by the time I was out of the hospital, they still weren't completely sure, what was going on. So I had to do like an MRI. I had a neurology team come in and take a look at me to see what was going on. It was a really, really horrible experience, having meningitis, and I don't want to ever have to deal with that again, especially being in the hospital because it was horrible. While I was in the hospital with the meningitis, I still had my headaches. Obviously had a fever, body aches, I had nausea. Like I was just dealing with so much, and I was very, very sick, very sick. And a really funny one. I mean, maybe it's not funny, but it's kind of a joke for us now because while I was in the hospital, I was having auditory hallucinations. So I was hearing things that weren't actually happening. And one of the things I thought I heard one day was, so Megan was with me basically every single day I was in the hospital from essentially like 7 in the morning until almost midnight. So, I love her to death and I can't ever thank her enough for staying with me. But at one point I thought she was playing Super Mario, or like I thought I heard Super Mario coming from her phone, and I asked her, I'm like, are you playing like Mario or something? And she's like, no. I'm like, why do I hear that? So it was really, really weird. And then, another thing was they don't play any kind of music in the hospital, at least not in my room and not like on the floor I was on. And there was nothing playing, but I thought I heard like the electric guitar playing. And at some point I thought I heard Chris Daughtry playing something like as if it was on the radio or something. And I asked Megan, I was like, is that Daughtry? And she was like, what? Like, what are you talking about? So super, super random. I was having these auditory hallucinations and they eventually, kind of started to fade away, but it was very bizarre, and my mind's just wasn't in a good spot. I was having a lot of issues with memory. Megan and I would have conversations and I would forget, basically 10 minutes after we had a conversation, I would try and talk to her about the same thing. And I just, I had like no recollection of having those conversations. So my memory was all funky and it was just a bad time. So I just want to like quickly discuss, the side effects I had were pretty much immediate and they were very overwhelming from basically the get-go when I started my treatment last year. There was basically not a single day for around 2 months where I felt comfortable. Like I was dealing with something every single day for 2 months until we got off of that treatment. So the treatments itself from last fall, I was supposed to have 6 rounds of it bi-weekly for 12 weeks. So, wait, did I say that right? 6 rounds bi-weekly. Yeah, so it was a 12-week period of treatment every 2 weeks. I didn't make it even through half of the treatments. I only got through 2 of them because I got my first treatment, then I had to stop because I had to go on the steroid because of the rashes, and then I got off, and then I took the treatment again. And then by that time, it was December, and then I started developing like the fever symptoms, and then I had to be hospitalized. So I barely even got through that treatment because it was causing me to feel so ill. Having to live with that many side effects at once, again, it's so horrible. And that's why I said, like, if surgery can remove the cancer for you and hopefully eradicate it for you, opt for the surgery. As crappy as the side effects are from surgery, I would take the side effects from surgery over what I had to deal with for my immunotherapy at any time because it was just so horrible going through those side effects with my immunotherapy. And with all that discomfort, like I'm sure the conversation came up, like, is it maybe something like, should we stop the treatments? And it's weird because while I obviously have a choice in whether I want to do any of these treatments or not, you also feel like you don't. It's kind of an interesting situation where obviously it's your body, so you can make your own choice whether or not you're receiving these treatments, but like, Megan and I obviously defer to our specialists because they know what they're talking about and like they've seen these things before and they have our best interests, in mind. But while I could have said, I don't want to do this anymore, it's like, could I really have done that? Because, I mean, we were trying to essentially treat my cancer to keep it at bay, but then I was having the side effects. So it's like, well, do I keep going or do I stop? And it's a tough situation, like there's no right or wrong answer to that. But it didn't really feel like at the time that I could stop, even though I was having all those symptoms. And my healthcare team at the hospital, they were nothing but supportive through all of the side effects. Like they were obviously doing their best to help me get through those side effects. But obviously, like they're also limited by, you know, what they can tell from, the tests they do, like blood work, CT scans, x-rays. So it's hard. Like even though these are some common side effects that people face while on immunotherapy, um, it's just difficult for them to make like an actual decision of like, do we stop? Do we continue? And like my doctor did ask me, like, do you want to continue going? And like I always said yes, because I wanted to keep the cancer at bay. So moving on, so yeah, we stopped that treatment, and then after Christmas, I was on steroids again to reverse the basically the effects of the immunotherapy and trying to like get rid of the aseptic meningitis. So I was on steroids for, and just to be clear, for those of you who don't know, when I say steroids, I don't mean like the bodybuilding, like kind of steroids. Like, I mean steroids to kind of like help you treat any kind of like, well, side effects that you might be having, and help, yeah, just to essentially get rid of those side effects and help treat for that. So I was on those steroids for about, I think, 8 weeks, so 2 months. And then at the end of February, kind of beginning of March this year, we started on my new treatment that I'm still on now, and it is working, thankfully. And the current medication I'm on, well, immunotherapy I'm on, is called bevacizumab and erlotinib. And so, again, kind of like my previous treatment last year, it's hard to tell which one is causing, the side effects I'm having now. They could be doing it in tandem together, or maybe one's causing, it's so hard to tell. But not that it really matters, I suppose, right? But I am having still a lot of side effects. So one of the big side effects I was having at the beginning of treatments was nausea. I still have a lot of nausea now, but it's a lot more manageable now. At the beginning, it was super bad, and then I was trying at that point to figure out like my nausea medication. So I take olanzapine twice daily, which is an anti-nauseant, and I also take ondansetron, which is kind of like an as-needed anti-nauseant. So I take that, I would say, probably once daily to deal with my nausea. Vomiting, which is a little more rare. I haven't had a ton of it this year, but there have been some occasions. But I think the vomiting has been because like my stomach's been like sensitive to some certain foods. So I'm thinking that like my stomach's just sensitive now and it just doesn't like something. So I think that's what's been causing the vomiting, because there's been a lot of times where I feel very nauseous and my stomach just feels super gross, but I don't actually throw up. So I mean, the medications are working very well, like my anti-nauseants, but it's, there have been days where I feel very, very horrible and I do throw up. Um, Part of kind of that nausea too, with my like my stomach is acid reflux. I've been dealing with a lot of acid reflux this year, and I take what's called pantoprazole. So that's it basically treats for acid reflux and heartburn, and it works extremely, extremely well. But I was having, kind of again at the beginning of the year before we kind of got all this down managed. It's taken a bit of time, by the way, to really figure out my medications and what will help treat what foods they can be eating. But heartburn and acid reflux was really, really bad for me, and it was like debilitating how bad it was. But thankfully now I've kind of got it under control. At the beginning of treatment this year, constipation was a bit of an issue then. It's not so much anymore. There are some days where I'm feeling constipated, but not really as much. One thing I'm dealing with is a lot of diarrhea. So I basically have diarrhea every single day, oftentimes multiple times a day. I've unfortunately been dealing with kind of like incontinence as well, as embarrassing as it is, but it's a very real thing. I've had quite a few accidents this year with, my diarrhea and accidentally like soiling like my underwear, my pants, and sometimes even in bed. It's just an unfortunate reality of it. Again, it is embarrassing, but it's not something I'm afraid to, be candid about, because it's a very real side effect of treatments, and it's just it's not something I can control all the time. I do my best to obviously get to the bathroom as fast as possible, but it's really tough some days because it just will come out of nowhere, and it's just really, really hard to control. There have been a couple times this year where I've had random bouts of fever, and I believe I've talked about them in all the videos so far to date. But there's just been random days of fever, and having to go to the hospital and make sure nothing's wrong, and obviously that comes with like body aches and stuff like that. But yeah, it's just fever is unfortunately one of the side effects that you can kind of get. Another big one that I've been dealing with all year is tiredness and fatigue and low energy. So, um, like I've mentioned, like I've been taking a long time to get these videos out. Like it's just hard when every single day I feel like I just need to be in bed all day. I have like no energy to do anything. I'm so tired all the time. I feel bad because like people ask us to do things. I don't really travel out of home very much anymore to like go see friends or family outside of the city. Um, it's really hard for me. Like I basically need to have a bed around me almost all the time because I don't know when I might need to nap or just lay down and relax. But yeah, I just have very low energy, and this is also like all these side effects. It's also why I'm not working this year, and it's been, that in itself is hard for me, not being able to be at work. But there's no way I can be working with all these side effects I'm facing and just having no energy to do anything, unfortunately. Another weird side effects I've been having is my mouth has been really, really sensitive. So it was worse at the beginning of the year, but it's still here. It's gotten a tiny bit better, but things like acidity, like really kind of like affects my mouth. Like for instance, like sour or uh, salt and vinegar chips are really hard for me to eat because like the acidity is just that vinegar is really hard on my mouth. Crunchy foods were really hard at the beginning of the year. Like chips, that's my favorite snack, and it was like making my mouth raw, like even just having a few chips, unfortunately. My biggest thing that is really hard for me is spicy foods. I can't eat spicy food anymore. Even like black pepper is hard for me to eat some of these days, and I just I've been eating spicy food for pretty much my entire life. Like I'm half Chinese, like it's part of like the culture obviously to have spicy food, and that's what I grew up with and that's what I've always had. And I can't eat spicy food anymore. It's just too hard on my mouth, and it like actually like it feels like it's actually burning my mouth, and like I will get sores from it if I even try. So it's really hard, living with not being able to have that when you've had it for like your entire life, and it's something I really enjoy, but it's just, something that I have to kind of live with now. Like last year, I've been having the rashes again kind of pop up on my face. Honestly, my whole body has rashes on it right now, but it's not like as bad as it was last year. It's pretty mild. It comes and goes. I have been on some medications for it, but I'm not currently on anything for it right now because it's kind of at a stable position. But yeah, rashes have been something I've been dealing with over the year. I've also been dealing with decreased appetite, so I'm not eating as much as I used to. I've lost about 10 pounds since I started the treatment at the beginning of the year. Um, it's at a stable spot now, which is good, but yeah, I don't eat anywhere near as much as I used to. Like, I'm having essentially like maybe a meal and a half a day kind of thing. Like, I barely eat anything for breakfast. I don't really eat lunch, and I have dinner, but eating has just been I just don't feel hungry a lot of the times. Foods make me feel sick and gross, and it's just hard to eat when you don't feel like it. And I think the last side effects that I've been dealing with, that I can think of, that you all saw from my last video, is my hair loss. So I have been losing most of my hair all over my body, which is, unfortunate. We think this is a side effect of the bevacizumab and not the erlotinib. If I were to stop the treatments, my hair would grow back normally and I wouldn't be dealing with the hair loss. But unfortunately, it's one of the more rare side effects, and unfortunately I got it, but that is one of the big ones I've been dealing with. And, I talked a lot about how that made me feel in my last video. It's been hard dealing with the hair loss, and, but everybody's been very supportive and they say, like it looks okay. So I hope that's the case. But yeah, it's definitely been, heartbreaking for me to be losing all my hair. And it's a weird feeling, it's weird when your body's just going through all these changes and dealing with things that you're not used to and that don't feel normal. So if you're dealing with these things, trust me, I know how you feel. It's just not pleasant. So I think that covers all the side effects. I know this video has been a bit long, but if you've made it this far, thank you for sticking through it. If you have any questions or you want to add anything about your own experience, let me know down in the comments section and let everybody else know. As always, I hope you found today's video informative and interesting. And don't forget to subscribe and leave a like. Until next time, take care, everyone.